Hello and welcome to the Arnold School of Public Health informational webinar. We're very happy to have you with us today. Thanks for joining us. We're going to talk a little bit about the Arnold School. We're going to highlight some of our degree programs for the undergraduate students in our school, and we're going to give you a little taste of what it's like to be a student in the Arnold School of Public Health. If you have questions as we go throughout this presentation, I might suggest that you jot those down. I'll give you some information about how you can reach out to us at the end of our presentation today. So you can ask us some follow-up questions or find out some more information about topics that we don't have time to dive deep into today. My name is Morgan Collins. I'm an instructor and advisor here in the Arnold School. I work mostly with public health students. We're very happy to have you, and I want to introduce some of our other faculty members who will be joining us on this webinar.
Hi, I'm Allison Harper. I am an instructor and academic advisor in the Arnold School of Public Health, and I typically work with students in exercise science.
Hello, my name is Sarah Patno. Like Allison, I am an instructor and advisor with exercise science.
Hi, I'm Cara Montgomery, and I'm a faculty member and advisor, and I primarily work with students in the public health major.
So a little background about the Arnold School. We are one of over 60 accredited schools of public health in the United States, but we're the only accredited school of public health in the state of South Carolina. We were formed in 1974 and accredited in 1977, and in 2000 we were renamed after one of our benefactors, Mr. Norman J. Arnold. We're very thankful for the support of the Arnolds over the years. Their donations have helped fund a lot of research specifically related to healthy aging and combating childhood obesity through physical activity and healthy eating. Our faculty offices, lab spaces, and classrooms are spread across several buildings on campus. The Public Health Research Center is one of our main buildings on campus. You'll see us there at least once a semester for advisement. That's where your advisor offices are going to be. The Discovery Building is important for you as undergraduate students because it houses our student computer lab and printing services. The Blatt PE Center not only houses faculty offices and classroom spaces, but it's also a working gym.
So we have 3 undergraduate majors in the Arnold School of Public Health. 2 of the degrees are Bachelor of Science, and then 1 is Bachelor of Arts. So I like to view all of these as a spectrum. So on one end would be the Bachelor of Arts in Public Health. So public health in general, it is broad, population-based. It's very proactive and preventative. We kind of consider it preventative health. It's trying to make sure that we can educate the population, help everyone so that we can prevent diseases or illnesses or injuries, anything like that. It's a Bachelor of Arts, which doesn't necessarily mean fine art or art the way you might think. It's more social science and behavioral science based. So a lot of times people studying this are interested in getting out and working in the community, a lot of education programs, things like that, health education. So on the other end of the spectrum would be the Bachelor of Science in Exercise Science. And this is more reactive. So it's a lot of working one-on-one with a patient or with a client, and there's an injury or an illness, and you're working to rehab that, to get them back to the point of their health where the person started. There's a lot of lab sciences required in that degree. So when you like the sciences, you like the lab sciences, the anatomies and things like that, but you're also interested in that broad population health, you can bring the 2 together. And then in the middle of this spectrum is the Bachelor of Science in Public Health. There's not one degree that's better than another, but the degrees might set you up for a different trajectory for a future career or a future graduate program. The next slide shows a bunch of different career options. The ones that are listed here are some that our alum have gone on to do after graduating from the Arnold School. I recommend you can pause this, take a picture of it. It'd be great. If you probably see on here careers that you already knew about, but if you see anything different, just Google it, look things up, start exploring really early on. There is no one public health profession. It is liberal arts, it is interdisciplinary because our students take courses from so many different departments. So when you're out and you're able to get a job after graduation, you are more versatile because public health really is everywhere. You're able to go out and you're qualified for different types of jobs. It's great because our majors do allow students to complete prerequisite courses that are needed for graduate school. We do have students interested in those clinical programs, and I believe Sarah and Carl will talk about later what different prereqs or what grad schools and what they want and how our courses fit into that. But what's great about the interdisciplinary approach and everything that we require of our students is that it's setting students up to be employable. So those skills that employers want, our students are learning. They're learning how to work as a team and critical thinking skills, communication, things that make you a good employee are added on top of the academic content. And that is what's going to set you apart from every other person who's applying for a job. This slide about core curriculum is really a breakdown of the degree. So it is the academic content that you're learning. About half of your degree at the University of South Carolina is the Carolina Core. It's pretty much the general education requirements. And that's required because our graduates will be well-rounded. So you're taking courses in different areas so that you are, a well-rounded applicant. Again, the biggest things are that the Bachelor of Science degrees require a significant number of lab sciences.
Part of your time here at USC, you'll be required with all three of our degrees to do some time in the field. And that time in the field will differ depending on your major here within the Arnold School. So for both of our degrees in public health, you'll be doing a project, a 50-hour project in the field, which is completed your last semester here at USC and in the Arnold School. So with that course, you'll be completing 50 hours in the field with a project, like I just said. But you'll also be taking all of your Carolina Core courses, like Allison spoke about, and your major courses. So it's really a culminating experience to really take all that coursework that you've had over your 4 years and apply that to the field and then reflect upon that experience. So that's a really great point of pride for us for public health. Some students in the past have done projects at food banks, the Ronald McDonald House, DHEC, which is the Department of Health and Environmental Control. But really with public health, the possibilities are endless because public health is everywhere. Flipping over for exercise science for students who are interested in that, it looks a little different. What your internship, your practicum will look like that time in the field. You'll be doing 300 hours in the field. You can do this course most likely your senior year, but it can be done your junior year with careful planning. And you'll work with your academic advisor about when's the most appropriate time to take that course. So it's 300 hours in the field, and we have community partners, as we like to call them, that love to work with our students, to mentor them and just work with them and gain experience at their place of work. And so students in the past have done practicums, as we call them, at physicians' assistants, local hospitals, physical therapy clinics, occupational therapy clinics, as well as the athletic departments here. We've also had students do their practicum at the Red Cross. So it's a wide variety of opportunities within exercise science as well. Also with the practicum, a great thing is you can do it anywhere. So not only in Columbia, but across South Carolina, across the US, even abroad as well. Many of you might be interested in going to graduate programs after your time here at USC. And so the great thing is with all of our degrees, you can take the time here at USC to work in a lot of those prerequisite coursework into our degrees, and we have that flexibility, which is very nice and it's great. And so throughout your time here at USC, you'll work with your academic advisor to plan those prerequisites to make sure you're accomplishing them and to make sure that you're working them in appropriately in where they fit into your degree. So not only do you want to accomplish prerequisite courses, there are also a lot of opportunities within South Carolina to make you just a well-rounded student. So USC has a great study abroad opportunity that I'll talk a little bit more in a slide or two. There's also a ton of research opportunities you can get involved in, not only in the Arnold School, but in just USC in general. So the Arnold School has 19 specialty centers that are just devoted to different kinds of research. So if you can find your perfect fit with us, we would love for you to get involved with our type of research. But USC also has an office of undergraduate research where you are sure to find your perfect fit with them. But I would always like to include the example Allison always likes to give about what research is. It's not always goggles, like beakers and chemicals in a lab. Public health and exercise science is much more human interaction based, so you'll probably be much more out there in the field, gaining experience, things like that. So I would encourage you to kind of take the time to look at what research we offer here at the University of South Carolina, and then reevaluate what your definition of research is. So like I just said, exercise science and public health are very human interaction based. So I would encourage you, while you're here at the University of South Carolina, to start joining and volunteering at clubs and just in the greater Columbia community, because you can start working and improving on those interpersonal skills that'll be very valuable when you start applying to graduate schools or just applying to jobs in the field of your choice, because those are really great skills to have when you start looking at careers of your given choice. And then lastly, one of the things I love about the University of South Carolina is, despite our size, students can make connections to faculty or staff. One of the ways you'll make a connection is with an academic advisor. Like Morgan said, is advisement. You'll have us all the time to have as a resource every semester that you're here. And so that's a connection you'll make one-on-one your first semester. So that's a great way to just know that someone is there for you your first semester right off the bat, all the way until you graduate. We've talked a lot about what the Arnold School offers, and then I've kind of talked a little bit about some opportunities you have within the Arnold School. So we just wanted to highlight one of our exemplary students within the Arnold School. So as you can see on this slide, Zach is a Bachelor of Science in Public Health who is graduating, and he's also an honors student and a McNair Scholar. But also during his time here at the University of South Carolina, he's really devoted himself to being a leader on campus and helping out the greater Columbia community. So I would encourage you to kind of take the time to read over everything he's done and the quote he's given about leadership skills, and then take his initiative to become involved on campus when you get here in the fall semester. So I touched on study abroad a little bit in previous slide, but just know that when you come to Columbia in the fall semester, that you have a lot of opportunities, and we strongly encourage our students who are interested in studying abroad to do so. There are different opportunities and different types of trips that you can look at, so one might be better for you than the other option. You can go a full year if you like, a semester, or a Maymester trip. I'll highlight our Maymester trips because I think they're just really unique and fun, and they could always be a good compromise between the student and a parent if you're not willing to let your student go for a whole semester. A Maymester trip is usually done for 5 to 6 weeks, and a faculty leads the trip. So the faculty will take a group of students over to a country, and usually within the Arnold School, I know specifically it accomplishes major credit. And so that's a really great way for you to accomplish major credit, get that study abroad experience, and for the parents or supporters in the audience, it's comforting to know that your student's not going out to a foreign country all by themselves. Last summer, we had Maymester trips in the Arnold School to Costa Rica, Italy, and Greece, and then Ireland. As you can see referenced on the slide here, we have a ton of different organizations within the Arnold School. And just really at USC, there's hundreds of organizations you can join. So please, when you come here in the fall, get involved right away. And I would encourage you to get involved with the Arnold School organizations as well. Your first semester here, you're going to be taking your Carolina Core courses, which are very important to your degree, but you'll be in those courses with every major. So you get a really wide, diverse knowledge base, and you'll get to meet a diverse group of people. But you want to start making connections with students who have similar interests to you, and these clubs and organizations are a great way to do that.
After graduation, just about half of our students are employed, which means that they have found a job. We do a survey of our graduating seniors, and we try to get answers from everyone. And so the rest of our students tend to go on to graduate school, and your advisor will work with you whether you are planning to pursue graduate school or employment. And we do have an excellent career center on our campus as well. In terms of exercise science students, after they graduate, you can see on the next slide that the careers and paths that they follow range from clinical focuses within physical therapy, occupational therapy, medicine, even chiropractor school, osteopathic medicine, to more administrative fields, working in health policy and management, even working in health promotion. We've had students work at gyms and personal fitness and going into nutrition. So again, the students' relationships with their advisor will help them pursue their dreams. With public health students, they also might go on to a clinical career in medicine, even nursing. We've had students who have gone on to pursue an accelerated degree in nursing. There's a wide range within the field of public health. There's MPHs that people can pursue, Master of Health Administration. So we've also had students go on to law school, and even you can see here music. We've had students go to Teach for America and the Peace Corps. And your advisor will support you, and you may change your mind during school, and that's fine, and we'll help you figure out what's the best path for you. Now, we have learned over the years that a lot of our incoming students want to be physical therapists. So we wanted to include some information about that. In my lifetime, you used to be able to just get a physical therapy job with a bachelor's degree. Now you have to have a doctoral degree. So there are accredited programs across the country, and they have stayed the same pretty much in terms of the number of students who are enrolled at those schools. The number of applicants to those schools has grown and increased because this is a very popular field. Luckily, we prepare you well, so if this is something you're interested in, we are going to help you get into PT school. And you can see from the bottom bullet that of the 107 USC students who applied for admission to PT schools, 72 were accepted, which is a great percentage. Not everyone's going to get in their first time. Sometimes people have to apply a second time. The great thing is there are options throughout the Southeast. So again, a good relationship with your advisor will help make sure that you have the experience and the courses you need to apply and succeed. Another popular program for our students is occupational therapy. And again, we have a slide that talks about, and you can see how competitive it is to get into OT programs. There are doctoral programs, and there are still a few master's programs. Eventually, all of the programs will be doctoral programs. And like physical therapy, the number of seats hasn't really changed much, but the number of applicants has increased. So going back to extracurriculars and jobs and things like that, that makes you more competitive. It's not just your grades and your GRE score. Another thing we wanted to talk about was PA school. That's physician assistant. In the 20 years I've been at USC, every year it seems like more and more of my advisees want to go to PA school. And the great news is there's a new PA program at USC School of Medicine, and there's some others throughout the state, which has given our students more options to apply. It is competitive, and the thing to think about and discuss with your advisor is how to get those hours of direct patient care that you need to be a successful applicant. Sometimes students need to take a gap year, and that's why on this slide you can see that the average age of enrolled students is closer to 25. It's not unusual for students to need to take a year to gain experience as maybe an EMT or a CNA as they prepare for PA school.
Okay, so you've gotten a lot of information and your mind is likely spinning. Don't worry. Take a deep breath. Take some time to process all this information. Talk to people that really care about you and that are important to you, and think about how all this is going to impact you. What we want to make sure you know is that we are here for you, and it's really about what you're passionate about. We want you to find things that you're interested in. We want you to be excited to go to class. We want you to be excited and enthusiastic about getting involved on campus and in research opportunities. And that's really our goal, is to help connect you to your academic resources and opportunities for you to be involved and get some leadership and get some experience in the field. If you have follow-up questions, please reach out to us. This last slide shows you some contact information for myself and for Allison Harper. We're happy to answer questions that you have related to topics that we talked about today, or perhaps things that you have questions about that we didn't get a chance to cover. You can also reach out to us in our live Q&A sessions that are going to be coming up soon. Refer to our website to sign up for those, and you can chat with an advisor and instructors in both exercise science and public health. Those are great ways to connect with us, and that information will be, again, posted on our website. We look forward to having you in the fall, communicating with you until then via email or Zoom, and we'll see you soon. Go Gamecocks!